Good morning. This is Dr. Sue. I hope everybody's having a great day so far. This is the week for us to talk about head injuries in our children. Head injuries are a very common occurrence, unfortunately, and one of the main patients that I see at my urgent care when I am working. I wanted to talk a little bit about the diagnosis of head injuries and what I want you to be aware of when your little one or your big one, adolescents, young adults, do fall and it involves hitting of their head. So head injuries in general, I always tell my families and other families at the pediatric urgent care that whenever there is a head injury, please reach out to your doctor. Please reach out to your doctor. It's important for them to know the mechanism of injury, how it happened, how they're looking right now, whether there was any vomiting. You know, there's specific criteria that we look at as physicians, and talking to you about how your child is doing and how the injury happened is very, very important. It's really critical. No matter how mild, it's always appropriate to contact your physician to ask for their help in managing this. Head injuries in general occur mostly because our kids are busy. Our younger toddlers are very busy. We are human. We have falls. We have children that unfortunately can take a tumble, that are infants when we even look away for a second. They happen, and it's something that I think one of the hardest things is to help families understand that guilt is something that is never helpful, and just to learn from an incident that occurs. For an example, having an infant that is starting to roll, generally that happens around 3 or 4 months, and you have them on the diaper table, and you bend down to get a diaper, or you look over for a second, and that baby rolls off the diaper table. So, those are things nobody intends for that to ever happen. And please know that that's why we're here. We want to make sure we address your feelings, how your child's looking, what happened, and really how to prevent future occurrences to happen like this. So I'm going to start off with the infant. And like I had mentioned, oftentimes it can happen where they just roll off of objects or furniture that is up above the floor. Unfortunately, when you have a baby that's under 2, the issues related to head injury that we're concerned with are sometimes difficult to assess in the young child. So oftentimes it's important to actually take them in to get them seen. If your pediatrician or your family physician feels that it's most appropriate for your child under the age of 2 to get seen, please make sure to do so. That way we can really assess and make sure there's no damage that had occurred that's going to put your child at risk. So under the age of 2 is a little bit different than over the age of 2. And what I always look at is whether the fall happened from a distance, and how far that distance is. The farther the distance, the more concerning it is. I always ask families about how they look. How are they acting? What is their behavior? Are they showing any symptoms of what we call altered mental status? Are they not responsive? Are they responding a little bit slower? Are they confused? Are they, in terms of infants, it's hard to know. You know your baby just based on behavior alone. So, looking at distress. Is your baby not able to console after a significant period of time, after a few minutes, after a half an hour? Is your baby still crying? Those are concerns. Also, I always ask about the extremities, the arms and legs. I always ask about the tummy, making sure that there's no injury to any other parts of the body. Oftentimes there can be injuries that involve more than just head injuries. With infants, you're going to also look at whether there was any vomiting. And the first 24 hours after an injury that involves the head is really the most critical. Vomiting is very different than spit up, and I always talk to families about the difference. Spit up is generally small amounts and can occur during feeds or shortly after. Vomiting is very different. Vomiting is a large amount. You may even hear your baby heaving with vomiting, and that is always a concern. So I want you to make sure to know that if you remember anything from this audio, that when your child, any age, hits their head and they start vomiting, that is a red flag to make sure that baby is seen. That's one thing I want you to know. So in infants, you'll often see also a head injury, a bruise that can happen with a head injury, what's called a hematoma, and it can get quite large. Just remember, it depends on where it is on the head. Oftentimes, injuries at the forehead aren't as concerning as injuries that occur at the side or the posterior of the head. So, just so you know a little bit about the things that we look at. In terms of your older kiddos, your 2 and up, those are kids that you'll be able to tell a little bit more with, especially if they have good speaking skills. What you want to do is ask them about headaches, ask them how their tummy is. You want to ask them where it hurts. Oftentimes they can do a good job of pointing and letting us know where things hurt. And you'll know when they're not feeling well. You're going to know with behavior changes. Behavior changes in the infant and the older child is going to be key to understanding how injured they actually are. Consolability after a head injury is also very important in the child 2 and up. And if they continue to cry and it's a half an hour, you want to make sure to reach out to your doc. Take a look at the extremities, take a look at the belly, take a look at the feet, the hands, any other areas that may be showing signs of injury. That's an important thing to look at. Signs of concussion can include, it can be a little bit hard in infants, but signs of concussion, which basically can mean a bruise on the brain, is where we get headaches, we might have blurry vision, our balance may be off, we may vomit, but generally not repeatedly. We also may have some tummy discomfort, such as nausea. We may have we may have some fatigue that's unlike us after this occurs. And symptoms of concussion can show up also within the first 24 hours. So, excuse me, whenever I see children of any age, I always tell the families to make sure to watch over them closely within 24 hours and to follow up with their pediatrician the next day, particularly if I'm seeing them in the evening. A big question that I get asked from families is whether or not they need to wake them. And it really depends on when an injury occurs. But if I see them anytime around dinner time or later, I usually tell the families to go on in a couple of times, particularly if they're an infant, making sure that they are arousable, gently arousable. You don't have to fully waken them, and making sure that there's no vomit in the bed, making sure that you're comfortable with what you're seeing. Keep in mind that you know your child more than anybody else. And if you feel that something is really off or you're concerned, do not hesitate to get that baby seen. Remember, we can see them at the pediatric urgent care. We also can send them to the emergency room if we feel that they may need imaging. For children that are vomiting repeatedly, that the urgent care is never going to be a place I want you to go. I want you to go to the emergency room when that happens, because at the urgent care we don't have the capability to image them with generally a head CT. And a head CT may sound scary, but it is one of the only ways to truly look at that brain and look at that skull to know if there is truly any major injury that's going to need assistance. So I hope this is helpful. I hope this gives you a little bit of an idea of what to do with regard to head injuries. In the next video, I'm going to talk about managing them as well as prevention. And that's something that's going to be really key, particularly in the summer months, in the warmer months when kids are really out and about on bicycles and, hoverboards and skateboards and things like that. And we'll talk about that as well. To end this audio today, I want you to remember your doctor is always there for you. Remember that we are not closed at 5. We have on-call hours every day of the week. 365 days of the year, your pediatrician has call hours. That means that you give them a call. They'll probably have an answering service, and then the answering service will connect you. Your doctor's office is never closed. I always remind families of that. So thank you so much for taking the time to listen this morning, all. I hope you have a great day, and please be on the lookout for our next audio on head injuries, management, as well as prevention. Thank you so much.